Hey guys, today I'll be talking to you all about labrum tears and slap lesions. So the labrum is located within the glenoid cavity and it acts as a protector against friction. It also stabilizes the joint. A Bankart tear is caused by anterior dislocation, which also causes the tearing of the glenoid labrum. A slap lesion is separation from the bicep attachment point anteriorly and posteriorly. There are four types of slap lesions. The first one is fraying of the biceps insertion but no detachment. The second is detachment of the biceps and superior labrum from the glenoid rim. The third is a bucket handle tear, and it's called that because of the shape of the tear as we saw before in the anatomy slide. And the fourth is the bucket handle and biceps tear, so it's a combination of both. A few mechanisms of injury that are important. The main two are superior compression of the shoulder, so that's when the humeral head is jammed into the socket, and then the second one is just anterior traction. Some important signs and symptoms of this are pain during overhead activities and pain at night, um, grinding, popping, sticking, decreased range of motion, and a decreased amount of strength. There are three special tests that you can use to test for this. I'm not going to go into depth about that because I linked the videos for you guys so you can see. But the first one, the O'Brien's test, you basically move from position 1 to position 2, and if there's pain when you move to a different position, it's positive. The clunk/crank test, you're just looking for grinding, clunking, or clicking. And then the grind test is when you're looking for grinding and clunking. Some predisposing factors for this injury can be like chronic injury or overhead sports, aging, just a lot of repetitive behaviors. Some other conditions that it can be confused with are shoulder dislocation, shoulder impingement syndrome, or just even like rotator cuff injuries. A way to treat this, you just got to get a lot of rest and you can take medicine. There is an option for surgery, but that's like if it's causing you a lot of pain. Um, One thing I would recommend is physical therapy after this because you want to make sure the strength in your shoulder is back to normal so you can participate in your activities of daily living. One thing is that we can, as ATs, we can deal with it. It's something we can manage. It's just a lot of rest, depending on how far you want to go. But like I said, physical therapist would be the route to go after surgery, and even if you're not getting surgery. There are no mulligan techniques for a tear, but there definitely are shoulder mulligans that you can do just to kind of make it more comfortable for the athlete.